Yes. Hello, everyone, and welcome to a new edition of Mastering the Menopause. And today, my guest is Doris Ziegeldorf, and she is based in Idaho in the US. She has been a nurse practitioner for over 25 years and has been involved in the care of women and hormones. And she has a virtual practice called Demystifying Menopause. And today, we're going to have a very, very detailed discussion about menopause and how it affects women through the years and what they can do to help alleviate some of the symptoms. So, welcome, Doris. Lovely to have you here.
Glad to be here. Glad to be a guest. Thank you.
So, before we get started, can you just tell us a little bit about how you got into this field and what attracted you to women and hormones and menopause in particular?
So I've been a nurse practitioner for about 25 years, probably the first 10 of those years doing a lot of primary care. And then I actually had a patient come to me who wanted to know something about her options for treatment. And so she had looked up somewhere where she could find a lab that would do labs for her and wanted me to order them and send them away and get back the results. And so when I did that, there weren't very many providers that were giving information about bioidentical hormones or labs. And so I quickly began to study because of my own history with having had a hysterectomy and in my 40s and was placed on bioidentical estrogen and sent upon my way. So I learned that women needed to have options. That nothing was said about the fact I didn't sleep at night. Nothing was said about the fact I was so irritable until I went to a conference where they insisted that we do lab review. And then in small groups, we went over our results. And I found out my progesterone level was almost not recordable. So balancing those for myself allowed me to sleep well, have energy, and many of the symptoms were controlled. So having found that out for myself, I began to implement those options for my patients who I found were interested in doing something other than just being handed a pill and sent on their way.
So, what common symptoms um, do women going through menopause come to you with? And what sort of age group are these women? Because there's a myth that, because different kinds of websites say, oh, you become menopausal at so and so age, and then there's something called premenopause and then postmenopause. And then there's a lot of jumbling up because women get confused and they say, oh, well, I'm not yet in the menopause. Or they say, oh, I passed the menopause. So, what sort of symptoms do women come to you relating to menopause symptoms, and what is the age range with which they can present?
So the Endocrine Society says that perimenopause is when the first hot flushes and night sweats began to be a problem. And that perimenopause, those symptoms can be really severe for 3 to 5 years. But menopause itself is probably in our early 50s. It's a number of years after perimenopause. So 51, 52 years old, many of my patients are starting to come with menopausal symptoms. And then again, as we know from a definition by the Endocrine Society, it's 12 months of no periods before you actually become postmenopausal. So you're right. The myths are where am I in the process, and can the labs be tested and give me an absolute date? And we know that can't be done because every woman is different. And even though they're symptomatic, putting a label on which section you're in isn't really what they want. They want transformation from misery back to their vibrant health.
And
So
in
this,
what way do symptoms affect women's quality of life? I mean, we know there's a list of symptoms, and I think the difficulty that women have is that they can go to a website and get totally overwhelmed, and they get filled with a sense of dread because they read all these symptoms and say, well, oh my God, I've got to suffer with all this stuff. And then they'd rather not read it. And unfortunately, when you don't read things properly the way they're supposed to be read, you miss out on important things. So, in what way do these problems of menopause affect a woman's quality of life? Particularly things like hot flush. You mentioned hot flushes
Yeah.
and hot sweats.
I think the hot flushes and the night sweats are probably the most bothersome because they get very hot and very sweaty very quickly, and then it's gone in just less than 30 seconds. But it can happen anywhere. It can happen in a board meeting. It can happen as you're preparing to make a presentation, and then the perception is she's not capable, she's sick. And that's not so. And when you have hot flushes in the night, by the time they fling off the blankets, they're chilling already and they're ready to put the blankets back on. So they don't sleep well. And I think those are probably the first things that bring them in. Not the only things, but the first things are the hot flushes and the night sweats, which then cause insomnia, which definitely causes disruptions in their daily lives. It goes on, of course, as we know, it starts with the brain, with the foggy thinking, or just not being able to recall things that you could recall very quickly, and not realizing that brain health comes with the serotonin levels, and the oxytocin levels, and if those are not balanced, we feel like we're in a fog,
Hmm.
and it's really the brain things. So I think memory is a big issue. And then, of course, for women, it's the vaginal discomfort. And it's also the urinary issues where they never had urinary infections before, or the stress incontinence. And that's something that they didn't really hear about. It's the hot flushes and the night sweats that are the common things. If anyone mentions it's because you had a hot flush in front of a friend, and they'll ask, but no one talks about bladder issues and no one talks about vaginal discomfort, unless you have a really close friend that you can share that information with. I think skin changes are another thing where the skin gets dry, hair gets thin, or hair growth because of the slow reduction in the androgen level, where the estrogen level drops quickly, androgen level drops slower, and we get hair where we don't want it. And yet the hair on the head starts to thin. So those are many of the common ones that they present with. There are, though, Dr. Felice Gersh actually identified in an article 5 unusual symptoms that I don't think that women automatically think about or attribute them to menopause, and that's the heart palpitations, where it's because of a decrease of estrogen, but it causes overstimulation of the sympathetic nervous system to the heart, and their palpitations, and that worries women because they've not had palpitations before. Jaw pain was the other thing that she wrote about, and that was estrogen needs for lubricating joints and also collagen. Dry eyes. I don't think that women think of dry eyes as far as being a symptom of menopause, that they need to use eye drops for, or the quality or quantity of their tears. And then there's a body odor change that happens because of the imbalance of hormones that I don't think women talk about, not unless we're talking about vaginal discomfort or urinary symptoms. Do they ever think about the changes? And it is a hormone imbalance. And then again, the mood swings being to the level of irritability, over irritability, or breast tenderness and swelling. Women don't think of that as being menopausal, unless they're struggling with it and they want to figure out what's going on. So those are some of the symptoms that they come in, or that we involve with in our conversations.
And what's the commonest way that you would investigate women like this? Because many tests, like the Menopause Society, International Menopause Society, they say you don't need to test for menopause levels. If a woman is 50 years old, it's assumed that they're going to be out of whack, and you can't use tests to, you shouldn't be using those tests to diagnose whether they're menopausal or not. So what other tests should we be doing?
Well, I believe that there's a saliva test that women can do that will determine their cortisol level. And of course, that cortisol level is going to be directly related to their adrenal function, which sometimes is part of the reason for that anxiety or the panicky feeling is, again, their cortisol level's too high because of the stress level. So there's a saliva test that will test the hormones. It'll test estradiol, progesterone, testosterone, DHEA, 4 levels of cortisol, being fasting, at lunch, supper, and bed. And also it will test thyroid levels if they have not had thyroid labs tested. And you're correct. I believe that having a test to tell me exactly if I'm in menopause or not is probably not as important as if the patient wants to know what are the treatment options. If one of my hormones is out of balance, I don't want to be put on everything. I only want to correct in low doses the hormone that's out of balance. And there are other tests now. There's a peripheral finger stick test that can be used to test those same hormones. Venous blood draw is not as efficient because it doesn't separate the protein, the hormone that's bound to protein, and the hormone that's free.
The sex hormone binding globulin levels.
Yes.
So what sort of treatment options do women come to you for? And when they hear words like bioidentical, they hear about hormone replacement therapy, menopause hormone therapy. How does a woman who attends a menopause clinic or who feels that she might need treatment because her symptoms are affecting her quality of life, how does she get through this maze of what she needs? And what would that discussion be around?
So with my patients, the discussion would be if you want to use it in a pill form, if you want to use it in a cream form, and we use cream that goes on the skin, but there's also a vaginal cream or a vaginal suppository that can be used that is a local treatment, again, for vaginal tissue. So pills or creams, there are patches for estradiol. And again, estradiol is the bioidentical formulation for bioidentical hormones, or BHRT. A natural progesterone, not progestin, but progesterone, and then not Premarin, but estradiol, which are bioidentical. And they're usually made from plants, and they're the closest to what we made when we made our own well to be able to replace. And then my goal is always to use the smallest dose possible and move dosing up very slowly, knowing that we can reduce the dose later on if we feel like we need to, and we go from there. So it depends on what the woman is willing to do. If they don't like the idea of a cream, we can use a patch or we can use pills. There's also pellets. My clinic does not do pellet therapy, but there are clinics that do pellet therapy for estrogen, progesterone, and testosterone. So I think for me, it comes down to looking at what hormone needs to be balanced. And then once we know which hormone it is, it's looking at what's going to be the easiest for compliance. We want the woman to get balanced hormones, and we want her to be able to do it on a regular basis and put it as part of a routine. So if they're going to apply the cream, you can do it right after you brush your teeth, or right before you brush your teeth to go to bed if you're doing twice a day dosing or once a day dosing, or the patches. But I think for them, it's individualized. It's how do they want to treat and what's going to work the best for them. There are many compounding pharmacies here in America that will compound the creams, compound capsules for progesterone. So it's kind of, for me, it's individualized. It depends on what the woman wants. And if she starts out with one formulation and decides that that's not going to work, or she's missing too many doses, we meet again and we make a change. So it is
many of the symptoms, like sweating or the kind of environments they work in, all of this can determine, how, I mean, certainly I remember is that sometimes women who sweat a lot can find that their patches don't stay on or they fall off, or um, e- some women skin is sensitive, so they react to the stickiness of the patches. And the same thing happens with creams or gels. And also, like, not everybody tolerates oral medication the same way.
Right.
So, do they have, I mean, how long should a woman persevere before she comes to you and says, look, this is just isn't working for me. Can we try something else?
I usually see that about 4 to 6 weeks is the time frame where we should have a balance if we're going to be able to do it with that formulation. So the
Mhm.
goal is to reconnect about 4 to 6 weeks after we start a therapy and reassess to see how it's working. Because 2 weeks is too short. She's not going to see the full benefit at 2 weeks, but at 4 to 6 weeks, we're getting into that point where she should be feeling the benefit. And if it isn't, or if she's not happy with the formulation, that's the point in time where I would make a change and then reassess again at 4 to 6 weeks after a new formulation.
And when should women start, or when should women consider that this is the right time for me to have treatment? How does that discussion go? How do you decide with a woman?
So if she comes to me with hot flushes and insomnia and they're affecting her daily life at work and at home, and we get labs that tell me which hormone is out of balance, that's the point in which I would offer her to be put on a low dose of the hormone that's lacking, and then slowly titrate the dose if necessary. I'm not sure that I answered your question. Um,
Yes, it's about, how does she, what elements go into the discussion? What sort of history taking do you need from her to tell you, that starting hormone replacement therapy is a good idea now, or should we wait for 3 months? Would you like to evaluate what your symptoms are like? Are they definitely getting worse, or, in what way are they affecting your quality of life? Because you mentioned that there are other ways, because there are some women who can't take hormone therapy. Maybe they've had breast cancer or something. So you were talking about some other alternatives to hormone, like suppose maybe not even, they don't even have to have cancer. They just say, well, no, I'm somebody, my mother never had cancer, my grandmother never had cancer, my mother never had hormones, my grandmother never had hormones, I don't want to have any hormones. So what things can such women do to help with their symptoms?
sure.
Because there
So
may be a
one
period where they actually use something different before they say, well, actually, this isn't working or this is working. And then they come back to you and say, okay, now I'm ready to go on hormone therapy.
Okay. And many women have already tried something from the health food store. They've already tried something that their friend has told them about. Um, and those things that's what people do. It's when those things
Isn't
don't
that
work.
dangerous? Isn't that dangerous?
Well, I think that women do that because they're struggling. They're
Uh,
struggling with their hot flushes. And so they may try some of those things that somebody told them over coffee at the water cooler, or someone else has said this is working for me. So I believe that many women do not come to a healthcare provider at the first symptoms of hot flushes.
Yeah.
Someone told them that you dress in layers and they've already tried that. Someone told them to cut out their coffee and they've already tried that. And or they've gone to the health food store, or even the pharmacy now gives advice on over the counter products that they may or may not have already tried before they come. So I think what I do is try to look at what they've already done that
Mm-hmm.
has worked or hasn't worked,
Mm-hmm.
and what would they like to be different. And that different could be that we use some mindset things, some breathing symptoms that they can help to reduce their hot flushes. They can do some exercises, or a form of exercise, even if it's only 20 minutes 3 times a week, can help with the hot flushes. They can also do, some people, acupuncture works. Some people, it's massage therapy. There's even tapping that can be used to minimize hot flushes. And it's called emotional EFT, freedom technique. And it is a tapping procedure in which you can do, if you don't want hormones, there are a number of things that I use in my practice as alternatives or in combination as a modality to get a balance where the symptoms are not taking over their life and return them to vibrant health, which is really what all of us want
Yeah.
as we make our menopause journey.
Yes. And I suppose menopause, in a way, and the way it affects our life is, it's something that it's almost like counterproductive. Having too much information puts you in a kind of feel like, oh my God, this is still coming. And not having information makes you miss out on the benefits of meeting somebody like yourself and being able to have that open discussion. I think one thing that women often forget are the risks involved, that women face, because both of us know that menopause is quite a recent thing for the human race. It didn't used to be that common. Maybe
Yeah,
in the last 100 years or so, that women actually living long enough to experience menopause.
that's
So there
right.
are some myths about, whether you should or shouldn't be experiencing these symptoms, and I hear a lot of women saying, "Oh, I'm going to do whatever I can to prevent menopause." So, is menopause hereditary? Can you prevent menopause in using those kind of words? Can you actually avoid it in any way? Is it something you can put off?
It's a part of our journey. I think what the choices that we have is how we go about it, how we look at this change in our life when we're no longer childbearing. And for many of us, we're no longer child raising by the time we go into menopause. So in everything I've seen, it is not hereditary. So menopause is your symptoms of your grandmother are not going to be the symptoms that you necessarily have, although sometimes families will compare similarities and say, so it's possible that this might happen, or it happened with others, but nothing that I can find in the research says that it's that you're if you're miserable and if your grandmother was, you will be. It's not hereditary. But I find that people listen to other people in their family and have the perception that if they had a terrible menopause, I will have a terrible menopause. And I believe that women want choices. They want to have options, not just be put on something and sent away, hoping that they're not going to return with any other concerns, because those other body parts that we talked about are affected if we don't recognize what the deficiency of estrogen or progesterone and testosterone, then those body functions will suffer. The incontinence doesn't get better if we don't address the hormone that is lacking. And then they are miserable, and just the expense of all of the products that are required for some of the body functions that don't get talked about.
Yeah.
And aren't addressed. And again, in my conversation, we don't start with all 10 of them. We
No.
start with the ones that bother them the most, I let her know that we will have a discussion about some of the other symptoms as they occur, or if you're concerned about them, let's talk about things that you can do that don't require medications. And many of them are hydration,
Yeah.
exercise,
Yeah.
nutrition,
Yeah.
sleep, and those they don't require hormones in order for those to get better. And in the American diet, being able to decrease the gluten and the sugar and the dairy
Yes.
can sometimes give real symptom relief for a woman that hasn't even thought about the dairy that she has always been on since a child could be contributing to some of her symptoms.
Yes, and I suppose one of the key things is that we don't realize that what got us until menopause doesn't actually help us after menopause. It's kind of a different phase. What worked for us in our 20s and 30s is quite different to what would work for us in 40s and 50s. In many ways, we have to relearn how to live our lives, how to rebuild our relationships, how to rebuild our relationships with ourselves, balance our, because our roles are changing. Like you said, we may not be caring for kids anymore, our job positions. And I certainly know many women in very top corporate positions who are suffering with menopause symptoms, and many of them have to give up their jobs or they give up their careers because they don't want to be seen as that woman who's not capable of handling a board meeting because she breaks out in a sweat, or she forgets to turn the page, or she forgets what she's talking about. She loses her train of thought. So I don't think women actually understand to what extent it affects their performance, and they're too ready to give in without exploring all of the possibilities. And so, Doris, in regard to all of this stuff that you're doing for women with menopause, particularly with demystifying menopause, what other things are you exploring to increase awareness for women in your practice and outside? How do they reach you?
So they can find me on my website, which the website is again Demystifying Menopause, or DorisZiegeldorf.com. And also through the virtual practice, they can email me, and they can email me at doris@DorisZiegeldorf.com, and I will respond. I do a complimentary 15-minute conversation to kind of find out where they are and what they want to do, as far as if they want help and support, or if they just want appointments. And that's how they want to handle that. So that's how right now, with a virtual practice, as I don't have a brick and mortar building any longer, that's the best way to reach me, and I can schedule that on my schedule.
And I suppose, like from women across the world who will be watching this podcast, this interview, they may not all have access to the same kind of tests or medications that you have access to in the US. And would there be some way of knowing what kind of corresponding stuff they would have access to in their country? And would they still need to keep in touch with their doctors?
I would think that Women's International Pharmacy is very helpful to me to be able to know what's available in other countries and how
Like
it would
a website?
transit.
Is that a website or it's an organization? Women's
It's an
Inter-
organization. It's a compounding, yeah, it's a compounding pharmacy called Women's International Pharmacy. And they have helped me with other patients that are in other areas. And I believe they would need to stay in contact with their other provider, because we would want to be a team where
Mhm.
that other provider may not understand hormones, and many medical providers only got such a tiny bit of education about hormones that they don't feel comfortable addressing it. So
Mhm.
many of the patients actually have a provider that is going to order their mammogram for them, do their pap
Mhm.
when it's appropriate, and we become a team then. And then that provider can we can communicate, but I can take care of the hormones, and then their other provider is going to take care of the other things. So I think that works well. So far, it has been an exciting journey, and I would love to be able to help women be able to demystify this journey and make it a return to vibrant health and not misery, and encourage them not to give up. It's your journey. Let's make it the very best we can.
Thank you so much, Doris. And before we close, any final words, or tell us a little bit about what's new for 2022 and 2023 for Doris? What exciting things have you got on the horizon?
Right now, I'm hoping to expand the practice so that I can have a bigger impact for women in helping them demystify menopause. I would love in the future to be able to do retreats, or to do some place to gather where we could, now that limitations are less, to be able to gather together. But I can do group sessions if women want to join I have a 12-week group coaching if they want more support. We could do that where they're in a group, and then the bonuses for those are private conversations during that 12 weeks that we would talk about their hormones and their progress. So I see exciting things happening now that we are a little bit freer to move about the earth.
Absolutely. And I think women learn a lot from each other. They learn a
Yeah.
lot. So that would definitely be a wonderful, wonderful thing. It's been such a pleasure speaking to you, Doris. It's been wonderful. And I'm so excited for women across the world that more and more people like yourself are coming up to explore this area, menopause, and help women to understand it and have a much better quality of life. And I'm sure that, the more people that we can get together and share our knowledge and our perspectives and information, the more women are going to benefit. It's been an absolute pleasure having you. It's been really, really wonderful. And I look forward to having many, many more such conversations with you.
Thank you. And thank you so much for letting me be your guest. Thank you.
Thank you.